My name is Sikin Samanani. I am an occupational therapist and I work with Siksika Home Care. My role here is to work with clients and families to ensure that they have a safe home environment. So I could have a very busy day out in the community and then returning at the end of the day and just trying to capture all the details that I had on each visit, that they can have independence in their home. And if they require any modifications or accessibility, I ensure I work with housing so that we can get all of their needs met. Using CliniQuill has changed my workflow because now when I go into a person's house, the AI assistant is recording the entire conversation. It's transcribing everything that I've spoken about. I'm able to take photos within the actual app and come back to my office and generate a report that is ready to send to housing, to include on their chart, or to include with any other service providers' referrals.
My name is Tessa Jones and I'm a home care registered nurse at the Siksika Health Center. I'm very busy in my job usually. I get several hospitals calling a day. I get people calling, they want me to go see their daughter that normally aren't on our roster to see. And so charting is pushed to the bottom, and if I don't chart, then my coworkers who would see somebody right after me have no clue what I've done. And so a lot of pertinent information gets delayed being entered. CliniQuill has made my life so much better. I would be weeks behind on my charting, and now I can dictate into my phone as I'm driving, as I'm doing the work, and come back, and within 10 minutes I can have 6 people's charts done. It's incredible.
My name is Leo. I'm a community paramedic here at Siksika Health, and I've been here for the last 2 years. As a community paramedic, my job is mainly to keep people from the hospital, as opposed to transporting people to the hospital. So if they need treatments like IV antibiotics, for example, instead of them having to go to the hospital to get that done, I would go to them to their house. Transportation is a big issue out here for some people. They might not be able to head to the hospital every day. I use CliniQuill when I'm assessing patients. The main thing I think it helps me with is just charting, because I don't always get to go back to my office after I see a patient. It's usually I'm going patient to patient to patient to patient. So there'll be times when I'll get back to the office at like the end of the day and I'm trying to remember, like, did this patient say their symptoms started on Saturday or was that Sunday? And this is after like 8 hours and like 10 patients. So using CliniQuill, it helps me keep my charting accurate, and it helps me be more efficient with my charting as well.
So my name is Amanda Soviak. I am the NSWAC, which stands for Nurse Specialized in Wound, Ostomy, and Continence. And I work out of the Laverne Clinic for the Kainai community. So when you're dealing with wound care, some of the challenges that can happen is that your hands are full or dirty, especially when you're doing wound care. So taking notes and making sure that you're recording the important information such as wound sizes can be challenging, as well as just the amount of time that's needed to do the documentation, especially when we have multiple wounds happening at the same time. So I have found CliniQuill really helpful with just recording my conversations without having to stop and take notes. So it makes a really organic and a great connection with my clients. I'm sorry. We need a moment. We need a moment.
Thank you.
That has been 2 years. Guess what?
It's done.
It's done. Oh. Buzz is a hunter. And he was hunting and stepped on a nail. Okay, he's diabetic. Unfortunately, it gets worse. He got infected with necrotizing fasciitis, which means that you can lose your whole limb. He was on the table in the OR, and they were going to take his foot. And thankfully, the surgeon was like, I think there's hope. There's enough vascularization. Let's just try. So he canceled the amputation. I started working with Buzz and we started using different products and we're able to clean it up. And we've cleaned it up to the point where it was like almost healed. And we've been working for 2 years to get it healed. As of today, we are closed, which is like, this is a big moment for Buzz and for me. It's huge.